You were on Meet the Press last Sunday, and you were asked a question about President Trump's intentional downplaying of the severity of the coronavirus in February and March, as has been reported in the new Bob Woodward book. So as you know, you only get a limited amount of time in TV interviews, so I'm wondering if you can expand on how you view the president's response to the coronavirus and the questions you have about how this administration will respond going forward.
Over the course of these podcasts and, of course, in our activities at CIDRAP, we've made every effort to be nonpartisan while at the same time having a very proactive public health agenda. Our job is to call balls and strikes. It's not to declare allegiance for or against any one area or side or individual. Just call the balls and strikes. And what I commented on last Sunday in Meet the Press, which I think some found somewhat difficult because they wanted a very clear-cut answer, was the fact that if you go back and look at that February-March time period, for which has been the focus of much of the Woodward book, I just tried to, again, declare a ball and a strike situation where, as some of you know, on January 20th, I put an email out to a number of people who work with us that, in fact, this was going to cause a pandemic. This COVID-19 was going to be responsible for a pandemic, and we needed to get ready. It was going to be tough. Between January 20th and February 24th, when I published an op-ed with Mark Olshaker in the New York Times saying, let's get on with it. This is a pandemic, and we need to deal with it, even though no country and the WHO had not yet declared it. Throughout that entire time, I received lots of negative criticism from colleagues, from Democrats, and from Republicans who said, you're just scaring people needlessly. Don't do that. Why do you always have to do this? Well, bad news, Mike. And, of course, my effort was really to try to ignite preparedness. And so, I'm sitting here today saying, let's take a free pass on the February-March time period, because if you want to look at it, everybody who had information and could have had the same information we had at CIDRAP, and we were surely sharing that information. It wasn't like we kept it a close hold, should have understood this was going to be a pandemic. So at this point, I don't think it helps us at all to advance our activities today by going back and revisiting February and March. It'll be dueling clips on the internet as to who said what, when, and where by all these different parties. But I do care, absolutely care, about where are we at today? What have we done since March? We still don't have a national plan. We have 50 different state plans, many of which are not necessarily scientifically sound. We have a great deal of confusion about all kinds of aspects of public health interventions. And to me, that's where we ought to be focusing right now. Let's keep our eye on the ball, folks. Let's keep remembering that we've got a long ways to go yet. Even if vaccine becomes available at the end of the year, it's going to take months and months before we can vaccinate the U.S. population. And with a vaccine, by the way, we don't know how well it's going to work. And so I just want to stay focused on demanding our leadership provide us the kinds of plans, the kinds of actions right now that we need, not only here in the United States, but around the world. This is not an indication that I, as a public health person, are not willing to take on these tough issues, but I also am one that basically doesn't believe it helps to go out and howl at the moon and hope that that's going to change the course of the public health challenge we have with COVID-19. So yes, I do hold our leadership accountable now, and I've held them accountable for months. I just don't want to get back into that time period from February and March and think anything productive is going to come from it. The other thing I just want to comment on, because this has come out time and time again relative to the discussion about who knew what, when, and where, is I keep hearing people saying, we didn't want to say anything because we didn't want to panic people. And as we've discussed on this very podcast about risk communication and how to communicate with the public in crisis, the bottom line is the public never panics when you tell them the truth. They never do. Just tell them the truth. Tell them what you know. Tell them how you know it. Tell them what you don't know and what you're going to do to find out, and they will follow you. That's what great leaders in the history of our world have done. They have not misled the public to make a situation worse or better than it really was. And so that's the other message I think that comes through right now. I learned as a kid back in that rural Iowa hometown, when in doubt, just tell the truth. And you don't even have to remember what you told somebody else before and might get it wrong. Just tell the truth. And I think that's what we have to focus on here. Action now and tell the truth.